CVI, the disease you didn't know could affect millions, including Trump. It started with headlines about Trump's swollen ankles, and suddenly, chronic venous insufficiency, a medical term barely anyone talked about, became one of the most searched health conditions on Google. But this isn't just political gossip. CVI is real. It's common, and it might already be affecting you or someone you know without you realizing it. What is CVI really? Chronic venous insufficiency happens when the veins in your legs can't push blood back up to your heart efficiently. Instead of flowing upward, blood starts to pool in your lower legs. That leads to swelling, aching, skin discoloration, and in serious cases, ulcers that don't heal. At first, the signs are easy to ignore. Persistent swelling in your feet or ankles, a feeling of heaviness, tightness, or aching, especially at the end of the day, itching or flaking around your ankles, reddish or brown patches of skin, and of course, the classic, varicose veins. Most people assume it's just aging or standing too long. But left untreated, CVI can lead to major complications, skin infections, chronic wounds, and even blood clots. Who's actually at risk? Here's where things get interesting. CVI isn't just an old people problem. Over 40% of Americans over 50 show early signs of CVI. It affects women more than men, especially after pregnancy. If you're overweight, the extra pressure on your veins increases the risk. Office workers, flight attendants, nurses, and anyone who spends long hours standing or sitting still are all vulnerable. Even athletes, particularly bodybuilders and runners, can develop CVI symptoms due to repeated leg strain and poor recovery habits. And yes, that includes celebrities and public figures. Famous cases that brought CVI into the spotlight. Let's start with Donald Trump. Recent footage showed noticeable swelling in his ankles and a change in gait. Some doctors speculated it could be chronic venous insufficiency, triggering a massive spike in public interest. But Trump isn't alone. Man-standing Joe Namath, NFL Hall of Famer, has spoken openly about venous issues in his legs after years of sports trauma. He's undergone treatment for chronic leg pain and circulation problems. Woman-standing Serena Williams has dealt with complications from blood clots and leg vein issues. Though more acute, they can evolve into long-term venous insufficiency if not managed. Man-standing Winston Churchill, long before modern medicine, was said to have battled severe leg ulcers, now widely believed to have been caused by untreated CVI. Even Barack Obama's former physician, Dr. David Shiner, once noted that many aging politicians suffer from circulation issues due to their long hours sitting during travel, meetings, and speeches. These cases highlight something important. This condition doesn't discriminate. It affects athletes, politicians, business execs, and likely people in your own family. Why did CVI go viral now? The Trump ankle footage acted like a spark. Searches for, why are my ankles swollen? Trump leg disease, heavy legs at night, all skyrocketed over 1,000% in just 48 hours. But it's more than curiosity. It's awareness. People saw a symptom they recognized in someone powerful and suddenly started looking inward. And ironically, that kind of public speculation may actually help millions catch the condition early. What can you do about it? The good news: CVI is treatable, especially if you catch it early. Here are 5 science-backed ways to improve your leg circulation. Get moving. Walk around for 5 to 10 minutes every hour. Even flexing your feet at your desk helps. Elevate your legs above heart level when resting. This helps drain pooled blood. Wear compression socks. They're clinically proven to support circulation and reduce symptoms. Eat anti-inflammatory foods. Berries, leafy greens, and omega-3s support vascular health. Maintain a healthy weight and stay hydrated. Veins love movement and hydration. They hate pressure and inflammation. If you're seeing symptoms already, talk to a vascular specialist. They can run a quick ultrasound to see how your blood is flowing, and you'll know if intervention is needed. There are also newer non-invasive treatments like endovenous laser therapy and sclerotherapy, far from the scary vein surgeries of the past. Final thoughts. CVI is often silent, but when left unchecked, it can quietly steal your mobility and comfort. And sometimes, it takes a public figure's ankles to get people talking. So ask yourself, are my legs unusually tired at the end of the day? Do I have swelling that doesn't go away? Have I noticed new veins or skin discoloration? If so, don't wait. Your legs carry your entire life. Take care of them. And if you found this helpful, subscribe. We break down trending topics that matter, so you stay informed, healthy, and ahead of the curve.